हेलो एवरीवन, टुडे वी आर गोइंग टू स्टार्ट आवर लिपिनकोट सीरीज जिसमें हम लिपिनकोट बुक के सारे क्वेश्चंस को सॉल्व करेंगे एंड डिस्कस करेंगे। सो टुडे इज डे 1 ऑफ आवर सीरीज जिसमें आज हम कुछ क्वेश्चंस को डिस्कस करेंगे। ऐसे ही हम डेली कुछ क्वेश्चंस को डिस्कस करके पूरे लिपिनकोट बुक को सॉल्व करेंगे। सो लेट्स स्टार्ट टुडे विद सम क्वेश्चंस। So here is question number 1 on the screen. You can see a client has obtained levonorgestrel as emergency contraception after unprotected intercourse. The client calls the clinic to ask questions about taking the contraceptives. The nurse realized that the client needs further explanation when she makes which statement. So you have four options on the screen and you have to select the right answer. So what can be the right answer of this question? So answer number 1 is the correct because this is the false statement. So we have to re-explain the client about this condition. Now question number 2 is on the screen. An antenatal G2T1PO AON living 1 client is discussing for the postpartum plan for birth control with her healthcare provider. In analyzing the available choices, which factor has the greatest impact on the birth control options? So you have four options on the screen and select the right answer. So they are talking about postpartum birth control. So what can be the right answer? So answer number 3 is the correct one. Breast or bottle feeding plan. Now the question number 3 is on the screen. Which information would be important to include the in teaching plan for the client who wants more information on ovulation and fertility management? So here are four options on the screen. Choose the right answer. Here's the information about ovulation and fertility. So answer number 3 is the correct answer. 14 day पे ovulation plus 2 days minus भी हो सकता है and plus भी हो सकता है. Now question number 4 on the screen. Which instruction about the activities during menstruation would be the nurse include when counseling an adolescent who has just begun to menstruate? So it's the counseling about a teenager who is just about to menstruate. So what can be the right answer? So answer number first will be the correct. We can take mild analgesia to reduce the menstruation pain. Avoid cold food is not all about the pain. अगर हम कोई भी cold food को avoid करेंगे तो उससे हमारा pain reduce नहीं हो सकता. So answer number 1 will be the correct. So now question number 5. After conducting a class for a female adolescents about human reproduction, the nurse concludes teaching has been effective when a students make which statement? So you have four options. You can read the options carefully. So what can be the right answer? So answer number 1 will be the correct. Under ideal conditions, sperm can reach the ovum in 15 minutes resulting in pregnancy. So sperm can reach to the ovum in 15 to 30 minutes in ideal conditions. Now question number 6 is on the screen. A 20-year-old newly gravid client expresses a desire to learn more about symptothermal method of family planning. Which information would be the nurse include in teaching plan? So here are four options. She is talking about symptothermal method of planning. So what can be the right answer if we take someone? So answer number 3 will be the correct answer. Cervical mucus is carefully monitored for changes. Cervical mucus के changes से हम पता लगा सकते हैं. Now question number 7. Before advising a 24-year-old client desiring oral contraceptives for family planning, the nurse should assess the client for which sign and symptoms? If someone desires to take oral contraceptive, what we have to assess? So what can be the right answer? Answer number 2 will be the correct, that is hypertension. Now question number 8. After instructing a 20-year-old newly gravid client about adverse effect of oral contraceptives, the nurse determines that further instruction is needed when the client state which as an adverse effect of oral contraceptive. So what can be the right answer? You have 4 options. So answer number 4 will be the correct, that is ovarian cancer. That is not an adverse effect of oral contraceptives. Now you can see question number 9 on the screen. Which information would the nurse include in teaching plan for a 32-year-old female client requesting information about using a diaphragm for family planning? So what can be the right answer? So answer number 2 will be the correct. Diaphragm should not be used if the client develops an acute cervicitis. अगर उसको सर्विक्स का इन्फेक्शन हो जाए तो डायफ्राम को यूज नहीं करना चाहिए. नाउ क्वेश्चन नंबर 10. आफ्टर बीइंग एग्जामिन्ड एंड fitted for diaphragm, a 24-year-old client received instruction about its use. Which statement indicates need for further teaching? So you have 4 statements by the client, and which statement need the further teaching? So what can be the right answer? Answer number 4 is the correct. If I gain or lose 9 kg, I can still use the same diaphragm. Now question number 11 on the screen. A couple is inquiring about vasectomy and a permanent method of contraception. Which teaching statement would the nurse include in the teaching plan? So you have 4 statements. What can be the right answer? So answer number 1 will be the correct. Another method of contraception is needed until the sperm count is 0. तब तक वेसेक्टमी के बाद sperm count 0 ना हो जाए तब तक हमको contraceptions का यूज करना है. Now question number 12 on the screen. A 39-year-old multi-gravid client asked the nurse for information about female sterilization with a tubal ligation. Which statement indicates effective teaching? So you have 4 options and you have to choose the right answer. So answer number 1 will be the correct. My fallopian tubes will be tied off through a small about the incision. So this is the correct statement. So the teaching is effective. So ऐसा ट्यूबल ligation प्रोसीजर के अंदर होता है. So this answer is correct. Now question number 13 is on the screen. A 23-year-old nulliparous client visiting a clinic for routine examination tells the nurse that she desires to use a basal body temperature method for family planning. Which instruction should the nurse give? So you have four options on the screen. What can be the right answer? So answer number 2 will be the correct. We have to tell her to take her temperature at the same time every morning before out of bed. Bed से बाहर जाने से पहले. So here's question number 14 on the screen. A client visiting the infertility clinic for the first time states that they have been trying to conceive for the past 2 years without success. After a history and physical examination of both the parents, what should be the most appropriate outcome for the couple to accomplish by the end of this visit? So you have four options. What can be the right answer? So answer number 4 will be the correct. Describe each of the potential causes and possible treatment modalities. So उनको अपने treatment modalities का भी पता होना चाहिए कि क्या क्या treatment उनके लिए available है. So now question number 15 on the screen. A 20-year-old primary gravid client tells the nurse that her mother had a friend who died from hemorrhage about 10 years ago during a vaginal birth. Which response would be most helpful? So you have four options. What can be the right answer? Answer number 4 will be the correct. What is it that concern you about pregnancy, labor और birth? हमको client के concerns के बारे में पूछना है कि इस scenario के बाद client के क्या concern हो सकते हैं. Now the question number 16. A 19-year-old newly gravid client visiting a clinic for a routine examination asked the nurse about cervical mucus changes that occur during a menstrual cycle. Which information should the nurse expect to include in the client stitching plan? So this is the easiest question and you have four answers. So choose the right answer. Answer number 3 will be the correct. As ovulation approaches, the cervical mucus is abundant and clear in nature. So this is the right answer. Now question number 17. When instructing a client about the proper use of condoms for pregnancy prevention, the nurse should include which instruction to ensure maximum effectiveness. So you have four options on the screen. What can be the right answer? This is very easy question. Answer number 1 will be the correct. Now question number 18. The nurse teaches a client about using medroxyprogesterone as a birth control method. Which client statement indicates an effective teaching? So read the options and let me know the right answer. So answer number 3 will be the correct. One possible adverse effect is absence of menstrual period. Now 19th question. Which instruction should the nurse include in teaching plan for a 30-year-old multiparous client who will be using intrauterine devices IUD for family planning? So 4 options on the screen. Choose the right answer. What can be the right answer and what we can teach if you are talking about IUDs? So answer number 4 will be the correct. Severe cramping may occur when IUD is inserted. Now let's talk about question number 20. Which information would the nurse include in a teaching plan about treatment for STI, sexually transmitted infection? So you have 4 options and let me know the correct answer. Answer number 3 will be the correct answer. Ceftriaxone may be used to treat Neisseria gonorrhea infections. Now let's talk about question number 21. A client is visiting the clinic because they have been unable to conceive a baby for 3 years for frequent coitus. The nurse determined that the couple need further instruction when they identify which factor as a cause of male infertility. So these are 4 options. What can be the right answer? So answer number 1 will be the correct. If this says seminal fluids with alkaline pH, because alkaline pH prevents the sperm from dying in acidic environment of vagina. So it cannot be a reason of infertility. So we have to teach the client for further instructions. Now question number 22. Okay. A preconception visit, a 24-year client is found to have malformation of the uterus. Okay, the nurse should figure out below to explain which uterine malformation. So this is an image based question. So which malformation is this? So what can be the right answer? This is Y shape. So क्या होगा इसका आंसर 4 options में से? So answer number 2 will be the correct answer. Now let's discuss the questions of the pregnant client receiving prenatal care. So let's start with the question number 23. A primary gravid client at 15 weeks of gestation has received teaching about concerning sign and symptoms to report and amniocentesis. So what should we have to report? So here are 4 options which can be the right answer. So in which case we have to teach the client further. So answer number 3 will be the correct. If my baby does not move, I need to call my healthcare provider in 15 weeks of gestation. So in this condition, we have to instruct more. Now question number 24. A nurse is caring for a client who is 12 weeks pregnant and speaks Spanish only. Which intervention should the nurse include in plan of care at the client's initial visit? It's a SATA question and the client is have only Spanish language. So what can be the right answer? Read all the answers carefully and let me know the right answer. So answer number 1, 4 and 6 will be the correct. Now question number 25. During a visit to prenatal clinic, a pregnant client at 32 weeks of gestation has heartburn. The client needs further instruction when she says she must do what management to manage her heartburn. So this is very easy question. Let me know the right answer. So what can be the right answer? Answer number 4 will be the correct. Consume liquids only between the meals. Now question number 26. A nurse is teaching new prenatal client about her iron deficiency anemia during pregnancy. Which statement indicate that the client need further instructions about her anemia? So you have 4 options and let me know the right answer. So what can be the right answer? Answer number 2 will be the correct. I may have anemia because my family is of Asian descent. Now question number 27. Following a positive pregnancy test, a clients begin discussing the changes that will occur in the next several months with the nurse. The nurse should include which information about the change that the client can anticipate in first trimester. So what changes can she anticipate in first trimester? You have 4 options and let me know the right answer. Answer number 4 will be the correct. Experiencing ambivalence about the pregnancy. So they can anticipate the symptom in first trimester. Now question number 28. An antenatal primary gravid client has been informed that she is carrying twins. The plan of care includes educating the client concerning factors that puts her risk for problems during the pregnancy. The nurse should realize that the client needs further instructions when she indicates carrying twins put her risk of which complication. So what can be the right answer? So answer number 4 will be the correct because having twins will not lead to group B streptococcus infection. Now question number 29 on the screen. A 30-year-old multi-gravid client has missed 3 periods and now visits the prenatal clinic because she assumes she is pregnant. She is experiencing enlargement of her abdomen, a positive pregnancy test and changing in pigmentation on face and abdomen. These assessment findings reflect this woman is experiencing a cluster and with sign and symptom of pregnancy. So this is important question and very easy question. So what can be the right answer? So these are probable sign. बेशक उसको साइन एंड सिम्टम्स आ रहे हैं, बेशक उसका प्रेगनेंसी टेस्ट पॉजिटिव है, तभी भी वो सिम्टम्स प्रोबेबल होंगे. पॉजिटिव कब होगा? तब क्या होगा? अल्ट्रासाउंड. अगर अल्ट्रासाउंड के अंदर प्रेगनेंसी पॉजिटिव आती है तभी जाकर वो पॉजिटिव साइन एंड सिम्टम ऑफ प्रेगनेंसी होगा. नाउ क्वेश्चन नंबर 30. When preparing a 20-year-old client for a serum pregnancy test, the nurse should include which information? So I have 4 options. What can be the right answer? So answer number 1 will be the correct. The test has high degree of accuracy within first week of after ovulation. Now question number 31. After instructing a female client about radio pregnancy test, the nurse determines that the client understands the instructions when the client state which hormone is elevated by this test. So you have four hormones as the option. So what can be the right answer? So the right answer will be HCG. Using Nagel's rules for the client whose last normal menstruation begins on 10th of May. The nurse determines the client's expected date of estimated date of birth is which date? So what can be the correct answer? Answer number 4 will be the correct by using the Nagel's rule. Now question number 33. After instructing a primary gravid client about the functions of placenta, the nurse determines that the clients need additional teaching when she says that which hormone is produced by the placenta. So this is the easiest question of this series. So answer number 4 will be the correct, that is testosterone. Now question number 34. The nurse assesses a woman at 34 weeks of gestation and is unable to find her fetal heartbeat. The fetal heartbeat was heard at client's first visit 4 weeks ago. According to the priority, the nurse should do the task in which order? All options must be used. So you have four options. So in which order the nurse should do the task? So answer number 4, 3, 2, 1 will be the correct order. So 4, second, फिर 2, फिर 1. Ask the client if the baby is or not been moving. Obtain different equipment and recheck. Explain that the fetal heartbeat could not be found at this time. HCP को कॉल करना. So ये सारे steps हमको करने हैं अगर हमको fetal heartbeat नहीं मिल रही है तो. Now question number 35. A primiparous client at 35 weeks of gestation questions the nurse about the need for an ultrasound. She stated, I feel fine, so why should I have the test? The nurse should incorporate with statement as underlying reason of performing an ultrasound now. So it's a SATA question. So you have four options and you have to choose which can be the right answers of this question. So answer number 1 and 2 will be the correct answer. The test helps us view the gross anatomy of fetus and we need to determine gestational age of the fetus by ultrasound. Now question number 36. A 20-year-old married client with positive pregnancy states, is it really true? I can't believe I'm going to have a baby. Which response by the nurse should most appropriate at this time? So you have four options. Which can be the right answer? So answer number 2 will be the correct answer. Yet, yes, it's true. How does that makes you feel? So we have to explore the client's feeling about her pregnancy. Now question number 37. A newly diagnosed pregnant client tell the nurse, I'm going to have all of these discomforts. I'm not sure I want to be pregnant. The nurse interprets the client's statement as an indication of which perception. So choose the right answer. You have four options. So these are sign and symptom of normal ambivalence जो कि फर्स्ट ट्राइमेस्टर के अंदर नॉर्मली फीमेल को एक्सपीरियंस होते हैं. Now question number 38. A client approximately 11 weeks pregnant and her husband are seen in antepartal clinic. The client's husband tells the nurse that he has experiencing nausea, vomiting, and fatigue along with his wife. The nurse interprets this finding as a suggestion that the client's husband is experiencing which complication? So the answer number 3 will be the correct, that is कोवाडे syndrome. इस syndrome के अंदर husbands को भी वो सारे silent symptoms आने लग जाते हैं जो कि उनकी wife feel करे during the pregnancy. Now question number 39. A primary gravid client asked the nurse if she continued to have a glass of wine with dinner during her pregnancy. Which statement would be the best response by the nurse? And you have four options. Let me know the right answer. Answer number 3 will be the correct. You should abstain from drinking alcohol beverages क्योंकि pregnancy के time harmful होते हैं. Now question number 40. Examination of primary gravid client having increased vaginal secretion since becoming pregnant reveals clear highly acidic vaginal secretions. The client denies any perineal itching and burning. The nurse interprets this finding as response related to which factor? You have four options and let me know the right answer. Answer number 4 will be the correct, control of growth of pathological bacteria. Now question number 41. When measuring the fetal height of primary gravid client at 20 weeks of gestation, the nurse will locate the fundal height at which point? At 20 weeks of gestation. So what can be the right answer? You have four options. So answer number 2 will be the correct. At about the level of client's umbilicus. At 20 weeks of gestation, हमको fetus height umbilicus के पास मिलेगा. Now question number 42. A primary gravid at 8 weeks of gestation tells the nurse that she wants an amniocentesis because there is a history of hemophilia A in her family. The nurse informs the client that she will need to wait until she is at 15 weeks of gestation for amniocentesis, which is the most appropriate rationale for the nurse statement regarding amniocentesis at 15 weeks of gestation. So it's a good question and you have four options to answer. So what can be the right answer? The volume of amniotic fluid needed for testing will be available at 15 weeks. तो वॉल्यूम ही 15 वीक्स पे आती है तो हमको 15 वीक पे ही हम ये टेस्ट परफॉर्म कर सकते हैं. आंसर नंबर 2 विल बी द करेक्ट. नाउ 43rd क्वेश्चन. After instructing a primary gravid client about desired weight gain during pregnancy, the nurse determines that the teaching has successful when the client make which statement? So you have four options. What can be the right answer of this question? Answer number 4 will be the correct. Although it varies, a gain of 25 to 35 lb, that is 11.4 to 14.5 is average. Now question number 44. When developing a teaching plan for a client who is 8 weeks pregnant, the nurse would suggest that foods to meet the client need for increased folic acid. So it's a SATA question. So which foods increase the folic acid in a pregnant woman? So what can be the right answer? So answer number 1 and 5 will be the correct. Now 45th question on the screen. A nurse instructs a primary gravid client about the importance of significant vitamin A in her diet. The nurse should knows that the instruction has been effective when the clients indicate that it should include which food in her diet that will increase the vitamin A. So what can be the right answer? Which are the richest source of vitamin A in these options? So answer number 3 will be the correct answer. Egg yolk and squash. 46th question is on the screen. A nurse is discussing dietary concern with the pregnant teens. Which choices are convenient for teens yet nutritious for both mother and fetus? It's a SATA question. So what can be a nutritious diet for both mother and the fetus? So 1, 3 and 4 will be the correct answer. Now question number 47. An antenatal client is discussing her anemia with the nurse in a perinatal clinic. After a discussion about sources of iron to be incorporated in the dietary meals, the nurse knows the client need for further instruction when she responds with statement. So we have 4 options. Check the options and let me know the right answer. So answer number 1 will be the correct. I can meet two goals when I drink milk, a lot of iron and meet calcium needs at the same time. Because if it intake a lot of calcium, it will decrease the absorption of iron. Now question number 48. The nurse instruct a primary gravid client to increase her intake foods high in magnesium because of its role in which process. So in which process we need magnesium? So answer number 2 will be the correct. Synthesis of protein, nucleic acid and fats. So here's 49th question. A client is at 24-week gestation. The nurse is reviewing the report of lab test as shown below. The nurse should report which result to the HCP. So this is the lab report and which should we report? So we have to report the VDRL test positive. Now question number 50th. A prenatal client wants to know why the nurse is asking about her use of herbal supplements. So which is the nurse best response? So here are the 4 options and select the right answer. So answer number 3 will be the correct. Understanding the full picture of what herbal supplements to manage your health will help us better provide coordination self-care. So answer number 3 will be the correct answer. We have to check the herbal supplements if the client is taking herbal supplements during the pregnancy. So this was the last question and we will discuss more question in our next session.